Hello, and thank you for joining us. The following video is from a recent webinar hosted jointly by the Institute of Economic Affairs and St Mary's University, Twickenham. And in this video, we hear from Dr. Adam Posen, the president of the Peterson Institute for International Economics, who discusses realistic global coordination in the economic policy response to COVID-19.
Thank you, Sayed. Thank you to St. Mary's and to the IEA for inviting me. This came out of an appearance with one of your IEA colleagues at the Parliamentary Evidentiary hearing from the Treasury Select Committee last month. And I am grappling as president of the Peterson Institute with what is practical in terms of international cooperation. But I want to also step back a bit and talk about what we know about international economic cooperation. Full disclosure, I was on the fringes of the G20 summits in 2008 to 10 as a consultant to the Cabinet Office and to then Prime Minister Gordon Brown. And those were seen as, I think rightly, as very successful measures, even though the economic crisis of that time was hardly solved. When we look at COVID pandemic and what's going on here, it seems like an incredible opportunity for international economic cooperation, that everyone is human, everyone is facing the same disease, everyone is facing the same lack of knowledge at the start, and obviously even more than Martin Luther King ever dreamt of, when you have a disease, an outbreak anywhere is essentially an outbreak everywhere. If you're New Zealand, you can put up barriers, but the UK or the US cannot in a meaningful way. And economically, what harms others harms you. So it would seem that this is a great cause and opportunity for international economic cooperation, even though that's not enough to solve the situation, because of course it is the biology and the local public health measures that are most important. But there is a lot of room for constructive international cooperation, and what we've seen is instead a very mixed record. So we've seen incredibly rapid and effective cooperation among central banks, including the Bank of England, the Federal Reserve, and the other major central banks. And very quickly, and I'm happy to go into this in the Q&A session, I don't tend to focus on this in my remarks, but very quickly, I think the central banks did a good job of keeping there from being a financial crisis, which would have been an opportunistic infection on top of the biological pandemic. And so we have very severe economic contractions, obviously, but they're primarily driven by the disease itself and the response to it, not by financial knock-on. And that was in part because the central banks moved simultaneously, made sure there was dollar liquidity available for everybody. So that was a great example of cooperation. But then we've seen in other fields, notably in public health, the opposite. We've seen various accusations made, all of which have some but not full merit, about whether it's China or the US or other countries not playing fair and not explicitly making clear the data on when and how they got their disease and the spread of the disease. Over time, China came up and did better. Over time, US has done worse. But there's certainly blame to go around. But public health seems like something where international cooperation should have been easy. Nobody should be accusing doctors of malevolent nationalist goals. And yet we have not seen that. And so it's also very interesting to point out that this lack of cooperation, and then I'll go into more of the economic aspects in a moment, comes at a time when there is surprising unanimity, or surprising to lay people unanimity, among the economics profession. So if you look around the world, Germany is getting into deficit spending. Noted fiscal hawks in the US like Carmen Reinhart and Glenn Hubbard and Kenneth Rogoff are talking about the need for fiscal policy and stimulus. The economics profession, with a few exceptions, in macroeconomics, but also in trade, is all coming down on one clear side. But the policy responses are very different. Now, I think that shouldn't be all that surprising, of course, because it's not as though the Platonic ideal economists come down and policymakers do exactly what they say. It's never been true. And certainly after the 2008 to 12 crisis and the politics we've seen in the UK and the US and Europe, around the world, the regard for experts, let's put it that way, has gone down. But it is striking that the unanimity intellectually has not conveyed over into unanimity in policy. So then one wants to think back about what was the nature of international cooperation. So Maurice Obstfeld and I, Maurice of Obstfeld of Berkeley and affiliated with the Peterson Institute, edited a brief volume in April that called for various steps on the G20 could take, and in particular, emphasizing things that could be done for the developing world in terms of debt standstills and restructuring, in terms of provision of public health, emphasizing things that could be done in terms of the rich world not engaging in bad behaviors that would be ultimately self-destructive, like putting up tariffs and hoarding on medical supplies. The main point we made is to realize that these were classic collective action problems. This is literally, there's a bunch of grapes that are out of reach of any of us on the vine, and if we stand on each other's shoulders, we can get to the grapes. There is money on the table. This is not a situation of international cooperation where it's I do something for you now and you do something for me later, or I do one thing and you do something in the opposite direction. And I think this is a very important distinction to make. My reading of the history of international economic cooperation over, say, the last 45 years is that it has generally succeeded when the ask has been that all economies, all governments behave in the same direction. They have a common threat, and they're either all abjuring one set of bad policies or all agreeing to one set of good policies. And obviously the contributions differ across wealth and across position. But it is important to me to point out that that's really what happened and worked in 2009, 2010 with the G20. Whereas there was a different school of thought on international cooperation exemplified by the Bonn Summit of 1978 and then the attempts at the Plaza and Louvre Accords in the mid-80s to manage currencies, where the idea was different governments would do opposing things. So the Japanese and the Germans in the mid-80s would do things to stimulate their economies, and the US would simultaneously raise its savings rate. And there are smaller examples of those attempts. And most of those, in my view, were failures. They were failures in that they didn't deliver the right set of policies, and the commitments were not fully held to. And even once they occurred, there was a great deal of grousing from the various members. I got exploited, or people reneged on promises. And so I think this is the kernel of the problem, is that the international cooperation efforts are best done when it is everyone pushing in the same direction against a common threat. And again, we've seen this right now in the central bank actions over financial panic. But that, of course, then doesn't explain why there are so many things being left undone at the moment, why international cooperation is not happening. And so I think that there are two main aspects. The first is what would we call the, sorry, I'm just checking my notes here. I want to be consistent. There is the political issue of domestic politics. So at what point, famously, the political scientist Robert Putnam wrote about what he called two-level games, the idea that you're negotiating at the international sphere and simultaneously you're negotiating with your home audience or legislature. And people who've lived through the whole Brexit experience of the last 4 years are very much aware of that sense of a two-level game. But the two-level game, I think, has ultimately proven to be not that useful an intellectual concept. All it does is warn you politics matters. It doesn't really give you any guidance as to when and how. And I think that to look at it, there is two issues, I think, why the politics is not working in favor of international cooperation right now. First is what we will what I would consider is international distrust. That for a combination of real reasons and ideological reasons, we have a great deal of distrust between Europe, the UK, US, and of course, a whole different level of distrust between China and each of those players. And it's a very soft concept for economists to speak about. There's obviously the famous book by Fukuyama on trust, but ultimately you can't get around this. This is the basic inability to trust in commitments and in good intentions is impeding what's going on. And there is a whole set of issues and a very lively debate in the US in the public sphere about, has the US basically been a sucker in its relations with China for the last 20 years, or has it just been unrealistic, or are things as good as they could have been? And of course, Trump, one of the many reasons he got to power was insisting that the US had been a sucker and had to play tough. A second issue, though, is what I'll call salience. Not every issue in domestic politics becomes important. And so, I was having a discussion just yesterday with a Nordic country official, and she was remarking with some incredulity on the total absence of concern for the enormous budget deficits the US is mounting at the moment. I mean, maybe they're justified now, maybe they're not, but there is just absolutely no traction in the political debate in the US about this. And I think that is an accurate statement. If you go out there in polling data, and we have long data series on this, you can say, well, do you care about deficits? And if you ask it that way, everybody says, of course I care about deficits. Debt's terrible. But if you ask people either a list of questions of here are 10 important issues, which are the 3 most important, they will in the US almost never say fiscal policy. Or if you ask an open question, say, what are the most important issues to you? They will almost never say fiscal. And so similarly on the international front, we have these extraordinary phenomena of huge swings in opinion in the US, where I know the public opinion data well, on international trade and on relations with Russia. And let me just speak about this a moment, because I think it illustrates a point. And I know Syed and his colleagues have a political science background and can critique some of my amateur lit reading. But on international trade, for example, the feelings about international trade are very, very non-robust. It depends enormously on how the questions are framed in the polling data. And we have series, again, that go back decades on this. But what's particularly interesting is that with the accession of Trump to the office of president, we've seen a massive shift in public opinion on trade. Democrats have become increasingly in favor of trade. Young people have become increasingly in favor of trade. And self-declared Republican voters who for years have been nominally pro-trade are now vociferously against. I mean, you're seeing swings of 40, 60% in opinion in these subgroups. Similarly on Russia, we've had decades of Hollywood propaganda under the Soviet Union, but long thereafter of Russian and Soviet nasties being our enemies. And suddenly Republican voters for Trump, or self-declared Republicans, identifying Republicans, have favorability ratings for Putin and Russia in the 70% range. So I think it's important to recognize that while we should not roll over once technocrats get agreement and say, okay, then we have to do what they say, we also should not be slavishly following what seems to be public opinion at the moment, because it shifts wildly and does not necessarily reflect deep preferences. But going back to the theme of international cooperation, and of course what I was just saying also applies to Brexit and some of the UK's international relations, you have this practical goals that can be met that would deliver benefits with either very small or zero cost. And these combination of international distrust and public opinion being skeptical on international interaction in general is forcing us to forego those gains. So let me talk in more tangible terms about what some of these mutually beneficial, mutually binding changes in government behavior would be. In particular, I think the obvious point would be talking about adjuring negative actions. As my colleague Chad Bown has spoken about and written about, and as I know the IEA cares deeply about, simple-minded trade protection in the panic makes you worse off. If the EU says they're not going to export medical equipment, or China says they're going to hoard inputs to medical supplies, or the US tries to grab intellectual property pursuant to a vaccine and not share it, what you end up doing is slowing the response to the disease. You end up making yourself more vulnerable because you may grab one thing to hoard, but then you're going to be short of something else. And you set off the possibility, which we saw until it was thankfully stopped, of some escalation and retaliation. There's my colleagues Annabelle Gonzalez and Colin Hendricks have written about this, and specifically in the impacts on developing countries, that they're completely at risk when this goes on. We shouldn't be glossy-eyed about this. The rich countries will get the equipment before the developing countries, even without these protections. But we can see how many lives this costs, frankly. And it would have been very easy, and it still would be very easy, for the international community to set up basically stockpiles that are transparent. And so you allow the rich countries to create stockpiles of what they consider the necessary goods, but you make everybody aware of them, and you make aware that there's free trade beyond those stockpiling, and then everyone's reassured and you don't have to hoard. I mean, this is similar to the sensible exit from a theater when somebody calls fire. Secondly, we can talk about debt forgiveness or debt standstills in the developing world. We suddenly have over 100 countries applying for emergency aid at the IMF and the World Bank. This has literally never happened in the 75 plus years we've had these institutions. 70 plus years we've had these institutions. Usually when there was a worst crisis, you would have somewhere in the low 20s of countries simultaneously applying. Clearly, this is what in central banking speak is a liquidity crisis rather than a solvency crisis. It's because people panicked and money flowed out of the developing world for legitimate reason, that they don't have the money to meet their debt servicing needs right now. And if one can bridge loan for them, just as our countries are domestically doing for small businesses and various distressed industries, they should be fine. And so we have issues of a debt standstill that would in the end save money. We're getting the debt standstill on the public sector debt, not the public sector borrowers, but the public sector lenders, and the leadership of the World Bank and the IMF are doing a good job on that. But the getting bilateral debts from, say, China, as well as private sector debts rescheduled is proving extremely difficult. And again, there are collective action problems, there are free riders, you can get into this in great detail, but ultimately this is a relatively simple problem in an extraordinary event where there should be a way to get ahead. I think we do have to acknowledge the success in stopping the financial crisis, and I've mentioned that. I think the next point beyond the protectionism and the avoiding the protectionism and the rollover of debts in the developing world is the question of vaccine and treatment development going forward. And there's a long literature and a long history in which the UK played a distinguished role about developments of vaccines and treatments, and about sharing of intellectual property or properly reimbursing through prizes and royalties developers of these treatments so as to incentivize them, but still making distribution possible. And the level of distrust we have, particularly vis-a-vis US and China, but even between UK and Europe, is frankly impeding the ability to either develop these material vaccines or to distribute them when they're ready. Again, there is some progress, some pushback, but we're in the striking situation where there is an inability to come to some common property rules. And this is not an intellectual fault. It's not even should be a political fault, because it is as with penicillin initially during wartime, this is not something where you expect the pharmaceutical sector to make huge supernormal profits. And of course, vaccine production is a very low value added, low cost exercise. What you're doing is amortizing R&D costs, which are trivial when you start talking about global economic costs. So we have all these shortfalls. Now, again, my hope is to be relevant. That's always the job at the Peterson Institute. And so not to be just sort of saying, oh, wouldn't it be nice if people could kumbaya, come together and do things? What I'm trying to make the case is that it is extremely striking in these areas where we have those grapes just out of reach, that collective action cannot be assumed to get us those grapes. And so I think I'm just going to conclude with what I'll call 6 ironies that, as a pseudo-academic, have occurred to me looking at this situation. The first is that secular stagnation, as Larry Summers has put it, which has driven down interest rates and inflation around the world, has actually made macroeconomic cooperation easier. The ability to fund our current deficits and to avoid currency wars is greater ability, in this secular stagnation, even though it's a bad thing. The second is that we have the markers every day, thanks to the Financial Times, the Johns Hopkins website, and others, of how badly governments are doing versus other governments in terms of fighting with the disease, but there seems to be little feedback on that. So in the US, we not only have the comparisons internationally, we have the comparisons between states and very marked differences in the course of the virus, but yet that doesn't seem to be inducing much change in policy. A third irony is, close to my heart, is the bizarre situation where central bankers seem to have gotten away with doing policy moves with less scrutiny and criticism than public health officials. And if you had asked any central banker 6 months ago, let alone in previous years, whether you would have been more trusted and given more discretion than the WHO or the Center for Disease Control, you would have been laughed at. And that again just shows one how quickly and transitory the shifts in public opinion take place. Fourth, I think it is scary that, and ironic, that the vaccine, which would be the true global public good, I mean, the external benefits versus the costs are so enormous, is the area where we're having some of the worst nationalist interactions. Now, that is something where I think a lot of the responsibility has to be placed at the feet of the Trump administration in the US. I think there is room for a deal with the Chinese, with the European Union, with the UK, with others, with the Swiss. But it is amazing that of all things, one is not able to get on that. The fifth irony, which might be fruit for discussion, is that as bad as things are in developing countries, it is this amazing sort of reversal of perceptions of governance that a number of developing countries, despite the worst hands they're being dealt, are actually dealing with the disease better than some rich countries. And frankly speaking, the perception that the UK and the US were always better governed and more pragmatic and more competent than many other governments, and yet our governments are frankly failing compared to the standards of others. This is a very striking irony, and even within the US, one is seeing things like the District of Columbia, which is not a state and which is looked down upon as a poorly governed place, in part for racist perceptions, is actually doing much better at controlling the disease than cities in the South and the West. So there's a lot of ironies in governance. And finally, I want to come back to something which none of you will have read, but 25 years ago, I wrote about central bank independence. And I made the political economy argument that it wasn't the institution of central bank independence that delivered low inflation. It was the coalition of interest groups who wanted low inflation delivered central bank independence, and that got you low inflation. And when that coalition went away, the institution might survive in form, but would not survive in impact. And I think that we're seeing this irony now, that we've spent a lot of time, unfortunately, building institutions at the international level only to see them be treated as norms or surface shallow things that go away very quickly. And this is a much broader political economy and political science point than I'm prepared to tackle. But just that it's ironic that we've put faith in the World Trade Organization or World Health Organization or the IMF, and ultimately what we needed to do was build the support for them and the coalitions that back them rather than the institutions themselves. Thank you again for your time. I hope this was of interest to people, and I hope there will be a good discussion.
Well, Adam, Dr. Posen, thank you very much for your opening remarks. I think that's given us plenty to think about. And as you can already see, there are 10 questions in the Q&A. We may not get through all of them, but please do keep the questions coming. Also, if you haven't asked a question, please do go to the Q&A anyway and help me by voting on the questions. That will help me if we run out of time. Just to let you know, I've also put a couple of links in the chat function. The first one is a link to the website for the Peterson Institute. And the next one I'm going to type in is a recent IA blog on how will COVID-19 affect global trade, and that preempts a COVID-19 briefing paper that the IA has coming out next week on trade. And similarly, I will put a couple more links in as we go through. But let's go straight to the questions. The first question at the top is from an anonymous attendee. How should international cooperation differ from 2008, given that the economy is no longer the cause of the crisis? Now economic outcomes are a symptom of a pandemic, not the cause. So should this change the authority that economic policy has regarding response?
Wow, that's a great and very broad question. I think the similarity between the 2008 crisis and now on the international cooperation front is the biggest things the rich countries can do, which are not very costly, is try to abjure doing stupid things that involve attacks on each other, involve taking us down from a recovery path. But you're absolutely right that this is a medical shock. And so while I focused on international cooperation, the biggest impact on what can happen to the global economy is basically when the disease is contained, which is partly a matter of biology and technology, and obviously partly a matter of domestic public health measures. And so, that is a very different challenge in terms of who is involved. It is, however, the kind of thing where one would have liked to have thought governments would listen to nonpartisan experts, which, I have to believe, and I know some in public health, they're one step further, more nonpartisan than the economics. And so it's quite striking. The other thing I would say is that, going back to one of the ironies I mentioned, one would like to think that mutual surveillance and transparency would help at least encourage countries towards best practice. But again, the shortfall from that is kind of depressing. So I'm not sure I've well addressed the comment, but just to say that I agree that there is a very fundamental difference. And if we talk to economic forecast, it's very different now versus 2008 in terms of the drivers. But the big contribution would be avoiding conflictual, harmful behaviors.
Okay, thank you. Next question from Professor David Middleton, who used to be the chairman of the trustees at the IEA, asks, isn't there some advantage to competition between different countries, or, for example, US states, in coping with a health crisis? I mean, other webinars we've had speakers who've argued for this sort of experimentation, if you like, or the Hayekian approach of discovery. I suppose that's what the lines David is asking. Over to you, Adam.
Yeah, I think that's normally valid, and certainly part of why we think we know what to do in the crisis now is because we can look back at the variety of approaches taken, for example, across the US during the 1918 to 1920 flu. And we know what happened in Philadelphia versus San Francisco with the wearing of masks, with the lockdowns. So there's always some room for experimentation. The problem is that sometimes things are more intellectually straightforward. I think no matter how many times people have tried to make this a more complicated issue, this isn't economics, this is public health science. And so the science is pretty clear that social distancing plus mask plus testing is the right thing to do. And so then you can argue about whether or not the economic costs of lockdown are worth it or not. And I think that's a very legitimate and substantial argument, but I think, again, the results are very clear. So the poor countries, you think of India, for example, or other countries in South Asia or parts of South Africa, that you have incredibly dense urban spaces, you have incredibly overburdened health systems, you have a very large share of the economy that's in the informal sector. And there, if you shut down the economy, people will starve or will, truly have horrible losses to their income and well-being. And upside of how much distancing you get and how much health system you preserve is not very high. And so I can associate myself with the idea of credible arguments why lockdowns might not in the end pay off in the developing world. But in rich countries where, whatever you think of the welfare state, and the US welfare state is very paltry compared to the UK, which is less generous than Western Europe, et cetera, most people are not going to starve as a result of lockdown. Most healthcare systems, it is meaningful in the rich world, whether you're overloading them or not. Most people are not living in such urban squalor that transmission is a foregone conclusion. And then finally, to go back to a different kind of Hayekian principle, which I'm sure your colleague will recognize, at some point, it matters less what the government does than what people want. And this is what we're seeing in the Sweden versus Denmark comparison at the moment. That ultimately, even if you don't lock down, if people perceive there to be a great deal of health risk that is going to diminish over time, they will go on a buyer's strike. They will not go to restaurants. They will not spend on large items. They will stop using certain services and public transportation. And so ultimately, the debate over lockdowns in the rich countries, for those people who have a choice, again, there are people who have to work and for various reasons, but for those of us who have a choice, or fortunate enough to have a choice, is less about the government policy and more about at what point do people get reassured. And so I think looking forward, I realize you didn't talk about this, but I think looking forward in the US, what we're seeing right now is in Texas and Florida and Arizona and various states where we're seeing very large outbreaks. Yeah, there was some initial foolishness and some initial well-intentioned experimentation as well. But the market is giving its verdict. The people are just not going to go back to quote unquote normal until they get the health risk perceived to be declining.
Okay, well, before we move to the next question, just to let viewers know, we've put a couple more links into the chat function. Dr. Adam Posen's put in a link to the Peterson Institute's work on the G20 and recovery. And I've also typed in a link to a recent St. Mary's University webinar that we had on the economy after coronavirus. Next question from an anonymous attendee. How do you think goals to restart the economies will affect sustainability and climate change goals for net zero by 2050?
It's a really important question, and it's one I'm wrestling with. And I honestly don't know. I can see it go either way. I can well imagine a bunch of debt fatigue, both legitimate and political, saying, okay, we've spent all this money now. We have to cut back once we get through this. We've got a lot of unemployed people because the hospitality sector is shrinking or certain services sectors are shrinking. We're not going to, on top of that, spend a lot of money on public investment, or we're not going to, on top of that, put more people out of work from the energy industry. I'm not saying that's a good thing. I'm saying that that's one scenario I can well imagine. The opposite scenario, which frankly I would like better, is one says, We have no private investment as far as the eye can see because of the state of the economy. We're already having to rethink about a massive reallocation of labor across sectors in a way that we've rarely seen in a short time. We need a useful form of public investment to sustain us, and we are putting in place apparatus, we hope, to enable the market reallocation of workers and capital. Might as well do decarbonization in a serious way when you're going through all that anyway. And then in the secular stagnation context, have a source of growth by investing in the new industries and the new technologies and the reallocation. That would be my preferred route. And part of the reason I was, though this was subtext and you obviously picked up on it, I'm trying to think more broadly about international cooperation is because I think that's going to be the next issue, is if Europe, in a sense, moves first, perhaps not in ideal, perfect ways, but does the largest, most serious moves on decarbonization in coming years, as seems to be the case, and the US, for example, is quite recalcitrant. How do you manage that situation?
But is the US really recalcitrant? Despite what Trump says, we see initiatives by states and even cities in the US to, despite what Trump says.
Yeah, and that goes back to your previous, your colleague's previous question, which is the value of experimentation. And I think there, not just because it serves green, I think there for genuine substantive reasons, because we don't know what the right technology is in the way we do with the public health of the pandemic, and we don't know what the transformations would be. I think the idea of variety and federalism in that sense is more positive in the global climate change issue. But I think realistically, that does also reflect, though, just the divisions, geographic and political, in the US. And so even if you end up with Biden as president, I would expect him to very quickly do a complete reversal and reimposition of many regulations in the US, which is on environment and other areas. And that's one of the things about Obama and Trump, and if there is Biden, that the president in the US has enormous discretionary power to change regulations. But what the president has no power to do is change taxes and major spending initiatives without the Congress. And so I think it's very unlikely, unfortunately, I think it's very unlikely you would get a carbon tax or anything efficient at a national level in the near term.
Okay. So look, we've got about 12 questions. We're not going to get through all of them. So if I can ask viewers to go to the Q&A function and vote on which you think on the questions you think ought to be asked, that will help me to select the questions at the top of the league, as it were, with Premier League football resuming in the UK. People will now be familiar with looking at league tables. Next question from Anka Shiv Bandari, who says, what do you think the impacts of the aftermath of COVID-19 might be on nationalistic trade policies? For example, Trump focusing on American products and jobs, India talking about focusing on India-made products, and made in China, for example, and might something come out in a UK post-Brexit? Just to let you know, or remind you, I put a link into a recent IEA blog, which foreshadows a briefing paper next week on international trade post-COVID. Over to you, Adam.
Yeah, and I'll put on the chat next week on Wednesday at Peterson Institute, we're doing a virtual event with Minister Liz Truss from the UK and myself in our series Trade Winds, moderated by Annabelle Gonzalez, talking about the UK role in international trade.
Oh, good.
But advertising aside, no, this is a very great concern, that the economic nationalism that was already there, and we prefer to use the term economic nationalism to populism because I think it's more specific and conveys what, to a greater or lesser degree, Trump, Orban, Bolsonaro, Duterte, the Polish government, to some degree the Johnson government, many others are pursuing. And as IEA and St. Mary's students should know very well, this is very strong echoes of the import substitution views that were complete failures for India and for Latin America in the 60s, 70s, into the 80s. That they were supposed to be a development strategy that would lead to industrialization, that would lead to competitive advantage, that would keep other economies from supposedly exploiting you, that would lead to not losing the window to get a gain in a technological field that's considered important, to assure supply. I mean, all of these things, you know, are arguments we've heard many times before. And again, the documented evidence on how disastrous they were for Brazil and Argentina and India and other economies that went this route is clear. And we at Peterson are going to soon release a paper by the eminent economic historian Doug Irwin, who's talking about the intellectual history of this movement. But so you come around now, and I do think the understandable, natural, though unfortunate impulse is you blame the other and you say, okay, we're going to stop the disease from coming in. We're going to make sure we're self-sufficient in masks and personal protective equipment and ventilators and this, that, and the other. And just, you know, basic economic logic. If you have a non-diversified supply, you got a problem. And if you can't make everything, you got a problem. And if you try to make everything, even if you're the US, let alone if you're a smaller economy in size and diversity, you will pay enormous costs to do it. And then we know that there are political economy issues, that it's very hard to avoid corruption when you have protected national champions producing things. And so then you end up with shoddy medical equipment or insufficient medical equipment or defective medical equipment. And this is, of course, something the Chinese have run into repeatedly. So I'm very worried about this risk. We are trying to write and agitate against it. And this is another reason why I think a G20 or other international agreement on trade and medical supplies would be extremely constructive so as to forestall some of that. And we've seen, again, speaking of decentralized solutions, we've seen some groups of countries, including New Zealand and Japan and Australia and Canada, a lot of CPTPP countries, but also some European countries, trying to make deals that would say, we're not going to do any more of this kind of protection. But it's a real risk. It's very bad.
Yes, as you say, there are causes for concern, but I think if I could just point out two causes for optimism, or reasons perhaps for optimism. One is, as you say, there were, I think, a number of countries that got together at the WTO and signed an agreement that they would lift these restrictions as soon as possible and would notify each other of any of these restrictions. We can put a link there from the WTO for that. And also, at UK, people were concerned whether, with the UK leaving the EU, would it be more protectionist or more free market? And the sign so far is that, for example, its new UK global tariff is actually more free market than the EU's common external tariff. 47% of goods under the EU are tariff-free. Now it will be 60% of goods will be tariff-free. So that fighting back, I wonder whether we could see a competition between the EU and the UK to sign trade agreements with third countries, as opposed to the EU falling into protectionism. But we'll see. Let's move on to the next question. Alian Malik. What is your view on the coordination and policy needed to protect the world's poor from COVID-19 and its economic effects?
It's an enormous challenge. And ultimately, one cannot make up for poverty and vulnerability through rich country action, but one can make things better. And in this situation, making things better means reducing the loss of life and also reducing the permanent scarring. My friend Jonathan Portis at King's College London did a recent paper talking about economic scarring in the rich countries. But of course, in the poor countries, it's far worse. By scarring, we mean if you fall out of the market or fall out of employment or are disrupted, what are the long-term effects? And in poor countries, we know that the effects on women, the effects on children's education, the effects on long-term health of recessions and disruption are very persistent and very large, negative. So what is it the rich countries can do? I mean, again, the first and foremost thing is part of what they're already doing, which is trying to recycle capital back in so you don't have huge capital flight of both foreign and domestic investors out of these economies so that you have liquidity shortages and lockdowns of the economy that have nothing to do with biology. And part of that is the IMF World Bank response about restructuring international debt. Part of that is getting private investment back in. And to be fair, some private investment has already started going back into it. The second thing is direct aid. And I'm not the expert on this. I have colleagues like Simeon Jankov, who's been writing on this with CPR. There are things that specifically the World Bank can do and the various multilateral development banks can do to provide direct food and medical aid to distressed people, obviously in concert with the local governments. But the biggest challenge is how, when especially the US and China are misbehaving, how do you give these economies a medium-term ladder out to development in the way that Taiwan or China or a few others have had? And we're getting very mixed messages on what that path is. And we're giving very mixed messages on what that path is. And a very interesting response was just the other day. I see Saeed has been posting on the chat about the WTO, and I posted a link there as well. And I think this is very important. The African Union actually took an initiative to make it easier for the countries of the member countries to acquire jointly medical supplies and distribute medical supplies. And South African President Ramaphosa, who is currently in the chair of the AU, announced this a couple days ago, I think. I have to think that, frankly, the way forward for the next several years is going to be integration in Africa, integration in South Asia. Obviously, politically, that's very difficult, but from an economic perspective, because they cannot count on US, China, or for that matter, the EU, giving them the opportunities that others had before them. My colleagues from different perspectives, Arvind Subramani and Robert Lawrence, both of whom are part-time between Harvard and Peterson Institute, have written about these issues, and there's a lot to think about.
Okay, next question from someone I know you know very well, Professor Philip Booth, both at St. Mary's University and also the IEA. And he asks, even putting aside COVID and the need for a vaccine now, I think it's fair to say that reform of intellectual property law is an area where there could be substantial gains, removing barriers to entry, reducing market power, reducing litigation costs, etc. As it happens, this is an area where the left often agree with some free market economists who are skeptical of strong protection of intellectual property. We actually had a debate between two IEA authors on intellectual property rights. I'll see if I can post a link to that. What's your view on where we should go with intellectual property reform?
No, I think, and Philip, of course, I think was with me in front of the Treasury Select Committee last month, and thanks to Philip for getting me in here. No, I think that's absolutely right. There are some issues. Intellectual property is probably the most important one, but the related issue in the US of occupational licensing, there are various restraints on trade that have become excessive where I think there is common cause between the principled free market right and the principled left. We can see that the Green Party in Germany, for example, has made up a lot of its economic agenda on these kinds of things. And we definitely are seeing in the US, and again, this gets into areas where I'm not expert, but I'm an avid reader, where network effects and incumbents in this technological digital age are getting incredibly dominant positions on intellectual property and being allowed to patent and trademark and restrict in ways that are probably not good for the society, for the economy, or for freedom. And so I do think there's a real agenda there. My colleague Jason Furman, who headed a commission that the previous Chancellor Philip Hammond had in place on competition in the digital age. Thomas Philippon at NYU has written some very interesting, both academic and more broad audience books on this topic. I think it is a really important agenda area. And you know, going back to both Adam Smith and Thomas Jefferson, you know, patent laws are intentionally meant to be a calibration exercise. There are advantages to making free access to technological knowledge, but the disadvantage is the disincentivation of innovation. There are advantages to incentivizing innovation, but there are problems if you don't allow free spread of knowledge. So you got to reset it. And I think And it is not arbitrary, ideally, but it is a decision where you set that trade-off. And I think there is a very strong case, and as Philip says, quite a reasonable cross-party, in a sense, case to be made that we, certainly in the US, have the trade-off in the wrong spot right now.
I've just put a link in the chat to a debate between two IEA members, Chris Snowden and Steve Davies on IPR. It just shows even amongst classical liberals there is disagreement on this issue. But I wonder if I could just come back to you on this question, because one of the things those of us who question the current rate IPR regime often asked is, well, that's all very well, but how do you incentivize innovation? Will it happen anyway? It's all part of human nature and the quest for progress. Or do you have to have things like prizes, for example, to encourage it? You know, what alternative would you propose to some of the IPR that we see at the moment?
Again, this is not a literature to which I've contributed. This is one where I'm a consumer, but my reading of the history is that you've said something very profound, Sayed, which is that there is a human desire and a natural human tendency towards innovation and improvement. And there are intellectuals like us, but people who do more practical things than we do, who create ideas just because that's what they do. And so I think the lesson of that is just to say the trade-off of reducing somewhat the patent protections and the incentives, the rewards of innovation is less steep than some people think, that you're not going to kill it off if you change the terms. Talking about awards and things, and Michael Kramer, the recent Nobel Prize winner, was my classmate at Harvard, has written in the past about competitions for vaccines and other medicines. The point of the prize is like the famous longitude clock case in the UK history, is when you need a very specific technology in a very short amount of time, which would be the case of the vaccine now. Yeah. You want to incentivize efforts going to that. And so that's, but again, in the spirit of earlier conversation, the point of the prize is you're not picking the winner, or rather you're picking the winner once the winner becomes evident. You're not picking the winner before the competition starts. Yeah. So I think you can have both, but the broader point, I very strongly agree with the way you framed it, that there, and this goes with Robert Solow's view of technological innovation as exogenous, to a first approximation, that sometimes you get good ideas and sometimes you don't.
Yeah, exactly. Okay, we've probably got time for one more question we could squeeze in. The last question is, the government's debts for many nations have increased. And so what impact does it have on the people within an economy, as governments in the future are likely to run budget deficits? And also, how will it affect relations with other nations? A couple of questions thrown in there, but see what you can make of it.
Well, let me try. I've actually, as I hope has been evident in this conversation, I'm actually reasonably free market and have some sympathies with the IEA and your counterparts in the US. But on fiscal policy, I'm probably considered pretty radically left-wing. I'm not an MMT nut job, but like my colleague Olivier Blanchard, and largely influenced by him, I think the costs, the short-term costs of debt and deficits in the public sphere, conditional on the economic situation, are much lower than were commonly perceived. And I'm not a Johnny-come-lately to this view. For our British colleagues, if you go back, I was arguing against some of the fiscal measures undertaken by the Cameron-Osborne government in 2009-10, in 2010, excuse me, they weren't there in 2009, 2010-11. Because in the end, the UK wasn't Greece, and ultimately, and this is why I mentioned as one of my ironies, the issue of secular stagnation. We are in an environment where rates aren't low because of something the central banks did. Rates are low because of some very fundamentals. There's a huge amount of risk aversion. There seems to be an absence of desirable private investment projects. The returns on R&D and on investment in the real world and private sector are down. Again, that doesn't exclude individual projects, but on average. And therefore, there is excess savings and low interest rates, and so it makes sense for governments to borrow. And so the issue is, at what point do you flip from being a trusted government to a non-trusted government? And what we've seen in this crisis is, surprisingly, a few countries, including South Africa and Brazil, have been able to expand their fiscal policies and not suffer in market terms beyond the general suffering in this situation. So I think it's just important to understand that there are points at which, in forms of government dysfunction, that mean that your fiscal policy doesn't work, it's unsustainable. But it's not a simple question of math. And I'm not going to have time, I guess, to type and talk at the same time, but I wrote a brief essay on this that came out, I think, last month, that it's the political institutions more than the political consensus about whether or not you can raise taxes in the future and whether or not you're spending the money on something worthwhile that determine the sustainability of your debt. It's not a simple algebraic question.
Thank you for watching or listening. For more details of our content online, please do subscribe to our YouTube channel, IEA London, or listen to our podcasts on Podbean. And to help us keep providing free content during these tough times, please do consider making a contribution, no matter how modest, by donating online at iea.org.uk, where you can also find much of our online content. Thank you for watching or listening.